too want to recognize Roy Blunt and his leadership in the Healthcare Solutions Working Group, working along with our other ranking members to come up with the Republican plan. Healthcare in America is about choice. At its core, it's about American families having the ability to choose the healthcare that best meets their need. And as we saw this week, the Congressional Budget Office said that the Democrat plan will cost at a minimum $1 trillion in order to implement. But that plan clearly misses the mark at many levels. First of all, we come to find out that maybe a third of the current uninsured are going to be covered at the expense of $1 trillion. As broken down on an individual basis, that is well over $6,500 per person to insure, when we know right now the average cost per individual in the private plans today is less than $5,000. Clearly, government plan is not the answer. So our Republican plan is sorely needed. We've got to come to a consensus on how we implement healthcare reform in a reasonable fashion that is responsible in terms of taxpayer expenditures and delivers on what the American people want, which is choice in their healthcare. So we do that starting with the premise that people ought to be able to keep the healthcare they've got if they want it. That is the essence of the choice that we're talking about. And once we establish that tenet, we then go and say, look, part of why this whole discussion has become so important is that the costs in this country have just come out of control and have led to increasing numbers of uninsured Americans. So how is it that we're going to afford the uninsured access to affordable coverage? The tenet that we operate on and our plan is based around is we want to provide access to a basic plan for all Americans and to coverage in terms of a basic plan. We do so by making sure we keep down costs and incorporate the ability for folks to pool together to access lower costs, to bring private sector into the game and keep government out. So I applaud the efforts that have resulted in the plan today. Look forward to working, as the leader said, with President Obama, Speaker Pelosi, to make sure that we do arrive at a consensus so that we can have some health care reform in this country.